Hello, I am Dr. Vishal Mukherjee. I am consultant surgical oncologist at Hope and Hill Cancer Hospital. Today, I will discuss on a very special topic which is called cancer survivorship. So, cancer, as the treatment of cancer is progressing every day, so as the number of the cancer survivors. Now, mostly we say that the cancers are curable, except when we see the disease in the last stage, on the stage 4, when the cancer has spread to the other parts. Otherwise, cancer is curable, and that has increased the burden of the cancer survivors in the society and as well as in our country. So, what is cancer survivorship? There are essentially 6 very important components of cancer survivorship. What are they? Number first is the education. What we need to educate? We need to educate the patient it's herself or himself regarding the disease. At the same time, we need to educate the family members or the care providers of the patient regarding the stage of the disease, what is the probable expectancy of survival in this disease, and the basic treatment guideline, which includes maybe surgery, maybe radiation, chemotherapy, or maybe multimodality approach, which includes all of them. So it's very important part to educate the patient and its family members. Second important part is the surveillance. After the treatment got over, in cancer there is always a chance that the cancer will come back. So very important is to be on surveillance. So we educate the patient and the family regarding a strict surveillance program, which includes regular checkups of the patient, which includes physical investigations, some blood tests, and maybe some scans at a regular interval. So these surveillance are equally important part of a cancer treatment. Why are these surveillance? This brings us to our third component, which is the intervention. So the surveillance actually helps to detect if there is any recurrence in any other parts of the body or in the same part of the body, so that we can identify the recurrence as early as possible and we can manage those, treat those before the cancer spreads to other organs. So surveillance and intervention are important part of the cancer survivorship. Fourth, very often less discussed but important part of cancer survivorship is a communication. Communication between the physician, the medical oncologist, the surgical oncologist, the radiation oncologist, and the patient caregivers. We need to communicate regarding their nutrition, regarding their food habits, regarding their if there is any addiction habits that they have to de-addict the tobacco or alcohol for future decreasing the incidence of cancer. So clear communication between the physician and the patient's home relatives are very important, in which the patient's relatives are also should be equally allowed to vent their own problems, like if they are facing problems in giving NG tube feeding, if they are facing problem in maintaining a wound, if they are facing problem in relating to the pain of the patient. So what is the severity of the pain? This should be clearly expressed to the physician, and the physician should stand with the family members and try to help them through a better communication from both sides. Fifth important is the research. So research is going on cancer. Still, it's a evolving branch, and there are medicines and there are palliative medicines, there are advanced therapies, there are advanced technologies coming up every day, and with each coming technology we are moving ahead with cancer, and we are getting close to a cancer, so that one day we can reach to a place where we can overcome the cancer completely. And the sixth and an important component of survivorship is a patient's advocacy. What is that? Patient advocacy means the insurance program, the rehabilitation, the financial rehabilitation, the employment of the patient after surgery. For example, a patient who has undergone a limb surgery, or limbs in which the patient's main occupation was maybe a driving or something else, and it was severely affected due to the treatment. So the government should come up with insurance, with a financial rehabilitation for the cancer patients, so that even after the treatment, if their occupation does not permit them to do that activity for long, they can be suitably employed in some other activity, so that they can earn their living. Another part of the advocacy, patient advocacy, is the economic part. The cancer treatment often requires a very large amount of financial burden. So government is coming up with all the schemes, there are schemes from the central government, there are schemes from the state government, and the patients are getting treatment from those schemes so that they can complete their treatment, and they do not They do not have to leave the treatment midway for their financial benefit. So these 6 are the very important component of cancer survivorship, and as we move ahead, the cancer survivor burden of our society will gradually increase. So it's high time that we all have a good communication. The government and the managing committee of the government should come forward with proper survivorship program for the cancer patients. Thank you very much.